Ebola hits Nick, doctor gets virus, fiancée and 2 friends quarantined. New York has its first case of Ebola. A Harlem doctor who recently treated patients in Africa tested positive for the deadly disease after he was rushed to Bellevue Hospital Thursday morning with fatigue, nausea and a 100.3 degrees fever. Dr. Craig Spencer, a 33-year-old Doctors Without Borders volunteer, and his live-in fiancée, Morgan Dixon, 30, were quarantined at Bellevue as investigators retraced the couple's steps from the 6 days since the doctor returned from Guinea last Friday, the sources said. The Associated Press reported 2 of Spencer's friends were also quarantined but had shown no symptoms of the virus. Authorities said Spencer had a 103 degrees fever, but Governor Andrew Cuomo later clarified that it was 100.3 degrees. Spencer's West 147th Street apartment has been sealed, and 2 of Spencer's friends have also self-quarantined in their homes, officials said. And an Uber car service driver who recently transported Spencer has self-quarantined as well, officials said. At a press conference Thursday night, officials claimed that Spencer had mostly stayed at home since his return. "We don't want to give the impression he self-quarantined, but he did limit his contact," said Dr. Mary Travis Bassett, head of the city's Department of Health and Mental Hygiene. Spencer went to the Gutter, a popular Williamsburg bowling and music venue, sources said. The bowling alley was shuttered Thursday night and issued a statement saying, "We've been in constant contact with the health department and they have determined that there was no risk to our customers." Spencer rode the subway in the past 5 days, traveling on the L and 1 lines, a law enforcement source told the Post. Modal trigger. Dr. Craig Spencer, right, and fiancée Morgan Dixon photo Instagram. His stroll along the High Line also involved a meal at a nearby restaurant, sources said. Spencer also visited Herald Square in his travels around town, sources added. Spencer did not show up at his job at Columbia Presbyterian Hospital, where he is a fellow in international emergency medicine, officials there assured. But investigators weren't taking any chances, and were at the hospital Thursday night to double-check that he had no contact with patients or staff, sources said. The NIPD's Missing Persons Squad is pitching in, looking at Spencer's Metro card, credit cards and bank statements to track all his travels and determine if any other locations need to be monitored, sources said. Meanwhile, the Federal Centers for Disease Control and Prevention was rushing a special response team to Bellevue. "We are as ready as one can be for this circumstance," Cuomo assured New Yorkers Thursday night at the press conference. New York is a dense place, a lot of people on top of each other. But the more you know, the less frightening it. Mayor Bill de Blasio added that there is no reason for alarm. Being on the same subway car or living near someone with Ebola does not in itself put someone at risk, he said. Spencer spent a month treating Ebola patients in Guinea, according to his Facebook page. He landed at Kennedy Airport last Friday on a connecting flight from Brussels, Belgium, according to sources. JFK officials checked his temperature upon arrival in accordance with new screening protocols, and it was a normal 98.6 degrees, the sources said. But Thursday morning, he awoke with nausea, a 100.3 degree temperature and stomach pains. Spencer stayed at his apartment and alerted Doctors Without Borders, which called the Department of Health and Mental Hygiene. Emergency vehicles swarmed Spencer's block at noon and completely shut down the street. A witness saw a person huddled in a wheelchair and swaddled in blankets being lifted onto a stretcher and into an ambulance. Knee specialists in hazmat suits soon sealed off his 5th-floor apartment, sources said. Spencer was rushed to one of 4 isolation rooms that have been set aside in the infectious disease ward at Bellevue, which has been designated a treatment center for Ebola cases that arise in New York. A hospitalized medical aid worker has tested positive for Ebola according to the New York City Health Department laboratory, a CDC statement read. The patient has been notified of the test results and remains in isolation. A specially trained CDC team determined earlier this week that the hospital has been trained in proper protocols and is well prepared to treat Ebola patients. Neighbors have seen the couple around town since they arrived home. Dixon even dropped off the couple's clothes at a dry cleaner on Wednesday. "I washed his clothes. I'll be okay, right? It'll be okay?" Worker John Bune, 60, asked the Post. Another neighbor was concerned about catching the illness after the case was confirmed. "I am in a state of shock. I am nervous about going inside my apartment now," said Rick Gordon, 17. "I am a little scared about this now because it's in my building. This just became very real and it's horrifying." Robert C. Dano, who works in Spencer's Harlem building, said he is concerned about catching the deadly disease. "It's worrisome," he said. "I don't know when he got back. But he has gone now, so I am relieved." Residents at the building were handed flyers with bullet points on Ebola, including symptoms and how the virus is transmitted. At least 2 Doctors Without Borders workers have contracted the disease so far this year. Norwegian physician Silje Lenny Michelsen was infected in Sierra Leone and recovered this month, according to the Nordic Page website. A French nurse was also diagnosed with Ebola on Sept. 16 while working in Monrovia, Liberia, and recovered in France. Additional reporting by Rebecca Harshbauger and Joave Gonan. View the story, Reactions to Nick Doctor's Ebola Diagnosis, on Storify, filed under Bellevue Hospital, CDC, Craig Spencer, Ebola, Harlem. Thank you for watching. Please subscribe to us on YouTube, Facebook and Twitter. You can visit us on www.therealthingme.webs.com.